The recommended bathing frequency for seniors aged 70 and above. 7 critical considerations. Are you showering too much? This could be a dangerous mistake, especially if you or a loved one is over 70. While daily showering is often considered essential for hygiene, the reality may surprise you. Experts warn that excessive showering can damage skin health, increase the risk of falls, deplete energy, and even cause infections. This video reveals 7 surprising facts about showering habits in the elderly, empowering you to protect health, conserve energy, and avoid unnecessary risks. Discover expert advice that may fundamentally change your perspective on showering after 70. Confront the facts and watch now. 1. The elderly are inherently vulnerable. Physiological changes in skin during aging, dermal thinning and loss of elasticity. Reduced collagen and elastin production. Collagen, a protein maintaining skin structure and firmness, and elastin, providing elasticity and rapid recovery after stretching, are significantly reduced with age, resulting in thinner, more fragile skin. Deterioration of the dermis. The dermis, rich in blood vessels, nerves, and connective tissue, nourishes the skin. Its weakening deprives the skin of nutrients and oxygen, leading to dryness, wrinkles, and increased vulnerability. Decreased sebum and sweat production. Reduced sebaceous gland activity. Sebaceous glands produce sebum, a natural moisturizer and skin protectant. Age-related decline in their function results in a loss of this protective barrier, causing dryness and cracking. Inefficient sweat glands. Sweat regulates body temperature and hydrates the skin. Reduced sweat gland activity exacerbates dryness, leading to flaking and compromised resistance to bacteria and fungi. The impact of these changes on skin health is significant and multifaceted, presenting a range of challenges for older individuals. Firstly, the skin's capacity for hydration is compromised. The stratum corneum, the outermost layer of the epidermis, loses its ability to effectively retain moisture, resulting in dryness, tightness, and desquamation. This dryness frequently leads to uncomfortable itching, which, in elderly individuals, can easily result in scratching, abrasions, and subsequent secondary infections. Severe cases can manifest as xerosis, a condition characterized by extreme dryness, potentially leading to fissures and bleeding. Secondly, the thinning of the skin renders it significantly more vulnerable to injury and infection. Minor trauma, even slight contact, can cause abrasions or bruising. Furthermore, the impaired cellular regeneration inherent in aging skin leads to slower wound healing. These compromised skin barriers create entry points for pathogens, increasing the susceptibility to a variety of infections, including dermatitis, Staphylococcus aureus infections, and the potentially severe condition of cellulitis. Finally, the diminished subcutaneous fat layer and reduced melanin production contribute to increased vulnerability to ultraviolet UV radiation and the consequent risk of skin cancer. The reduced protective barrier allows for deeper penetration of UV rays, accelerating the development of age spots, hyperpigmentation, and significantly increasing the likelihood of developing skin cancers. Therefore, diligent sun protection, including the consistent use of broad-spectrum sunscreen, high SPF, and appropriate clothing, is paramount to mitigating these risks. The proactive adoption of these preventative measures is crucial for maintaining skin health and reducing the incidence of skin-related complications in the elderly population. Excessive showering exacerbates this condition. The removal of natural protective oils by hot water and harsh soaps leads to increased dryness and vulnerability. Frequent showering accelerates dehydration, creating a vicious cycle of dryness, irritation, and damage. Furthermore, it disrupts the skin's microbiome. The skin harbors billions of beneficial bacteria that protect against pathogens. Excessive showering, particularly with antibacterial soaps, eliminates these beneficial bacteria, compromising the skin's defenses. Finally, it increases the risk of dermatitis and allergic reactions. Cleansing products containing chemicals can cause irritation, redness, and itching. The elderly are particularly susceptible to conditions such as eczema or contact dermatitis due to their already compromised and more reactive skin. Optimal skincare for individuals age 70 and above. Limit bathing frequency to 2 to 3 times per week. Avoid daily bathing. Utilize lukewarm water instead of hot water to prevent dehydration of the skin. Employ mild fragrance-free soaps with a balanced pH to minimize irritation. Immediately following bathing, apply a moisturizer to retain hydration and maintain skin suppleness. Supplement with collagen-rich foods, vitamin E, and omega-3 fatty acids to support skin health internally. Avoid excessive sun exposure and consistently apply sunscreen when outdoors. 2. Excessive bathing poses significant health risks. Excessive showering negatively impacts skin health in several key ways. Firstly, it strips away the skin's natural protective oils, sebum, leading to dryness, roughness, and increased vulnerability to damage. This effect is particularly pronounced in the elderly, whose sebaceous glands produce less oil, resulting in heightened susceptibility to dryness, flaking, and cracking. Secondly, overwashing, especially with antibacterial soaps, disrupts the skin's natural microbiome, eliminating beneficial bacteria and reducing its inherent defense mechanisms. This imbalance can trigger inflammation, irritation, and a heightened risk of bacterial and fungal infections. Finally, the depletion of natural oils and moisture weakens the skin's protective barrier, increasing the risk of infection. Minor skin fissures can serve as entry points for bacteria, potentially leading to conditions such as dermatitis, Staphylococcus aureus infections, and even severe cellulitis. Excessive bathing significantly increases the risk of falls among the elderly. Frequent bathing necessitates increased mobility in a typically slippery environment, creating a heightened risk of accidents. The bathroom specifically presents the most hazardous area within the home. Slippery surfaces, resulting from water and soap residue, contribute to a significantly increased likelihood of slips and falls. High bathtubs or smooth, tiled flooring present considerable challenges when entering and exiting the bathing area. Furthermore, steam-induced fogging of mirrors and wet floors severely compromise visibility, leading to balance impairment and a subsequent increase in the probability of falls. Prolonged exposure to hot water during bathing induces vasodilation, resulting in a decrease in blood pressure and subsequent dizziness. Elderly individuals may experience a pronounced feeling of lightheadedness upon standing abruptly, increasing their susceptibility to loss of balance and falls. If bathing occurs when already fatigued, diminished reflexes further exacerbate this risk. Falls among the elderly can have devastating consequences. According to the Centers for Disease Control and Prevention, CDC, a substantial 25% of individuals over 65 experience at least one fall annually, with the bathroom consistently identified as the most dangerous location. These falls can lead to debilitating injuries, including hip fractures, traumatic brain injuries, and permanent loss of mobility. For the elderly population, a single fall can severely compromise their independence, significantly increasing the likelihood of hospitalization and the need for extensive long-term care. The cumulative effect of these factors underscores the critical need for preventative measures to mitigate the risk of falls associated with bathing. Frequent bathing leads to significant heat loss, increasing the risk of hypothermia and subsequent illness, particularly in the elderly. The thermoregulatory mechanisms of older adults are less efficient than those of younger individuals. Consequently, post-bathing heat loss is accelerated, especially during colder months, potentially resulting in hypothermia, a dangerous condition characterized by abnormally low body temperature. This vulnerability is exacerbated by the compromised immune function common in the elderly population. The often warm temperature of the bathing environment creates a stark contrast with the cooler ambient temperature experienced upon exiting the bath. This rapid temperature fluctuation can induce thermal shock, further stressing the body's ability to maintain homeostasis. The resultant weakening of the immune system renders older adults more susceptible to common colds, pneumonia, and other respiratory infections. Therefore, careful consideration should be given to bathing frequency and environmental temperature to mitigate these risks. Maintaining a consistent and comfortable ambient temperature, both during and after bathing, is crucial for minimizing the potential for hypothermia and related health complications in elderly individuals. Excessive showering depletes energy and induces fatigue. Showering is not merely a hygienic activity. It demands considerable physical exertion, particularly for the elderly. For individuals over 70, showering is a strenuous process. Prolonged standing, bending to wash, and drying can lead to fatigue and exhaustion. Those with chronic conditions such as arthritis, osteoporosis, heart failure, or COPD may experience pain and shortness of breath while showering. Post-shower debilitation is common among the elderly. Following a shower, seniors often require extended rest periods before resuming daily activities. Frequent showering diminishes quality of life by diverting significant energy towards a seemingly simple task. To mitigate the risks associated with bathing, a multi-pronged approach is recommended. Firstly, reduce bathing frequency to 2 or 3 times per week, supplementing with daily hygiene practices focused on specific areas. Secondly, utilize lukewarm water. Excessively hot water can dry the skin and induce dizziness. Thirdly, select mild, hypoallergenic soaps with a balanced pH level to minimize skin irritation. Fourthly, bathe during daylight hours when the body is fully alert. Avoid bathing when fatigued or immediately after meals. Fifthly, install safety features such as grab bars and non-slip mats to significantly reduce the risk of falls, a leading cause of bathing-related injuries. Sixthly, consider using a shower chair or handheld shower head to minimize strain and physical exertion during bathing, particularly beneficial for individuals with mobility limitations. Finally, ensure thorough drying of the body immediately following bathing and the prompt wearing of warm clothing to prevent hypothermia. Adherence to these guidelines will contribute to a safer and more comfortable bathing experience. 3. Reduce the risk of falls. Bathrooms pose a significant threat to the elderly due to a confluence of factors. Firstly, the inherent slipperiness of bathroom surfaces presents a considerable risk. Water and soap residue create slick conditions on floors and bathtubs, increasing the likelihood of falls, particularly for individuals with compromised balance. The presence of soaps, shampoos, and conditioners exacerbates this hazard, further diminishing control and increasing the risk of injury. Secondly, the combination of steam and fluctuating temperatures contributes to instability. Steam from hot showers obscures mirrors, glass surfaces, and doors, significantly impairing visibility. The abrupt temperature change upon exiting the bathroom can induce dizziness, vertigo, and loss of balance, posing a serious threat, especially for those with hypertension, diabetes, or neurological disorders, who are at heightened risk of fainting. Thirdly, the physical act of entering and exiting the bathtub presents considerable challenges. The required leg lift and balance necessitate agility and strength, often lacking in the elderly population. High bathtubs or the absence of grab bars significantly increase the risk of falls and loss of control. Similarly, sitting down and standing up within the tub demands significant muscle strength, posing a considerable obstacle for individuals with muscle weakness or arthritis. Fourthly, the slower reflexes characteristic of aging exacerbate the risk of falls. While younger individuals can often recover balance or break a fall, the elderly experience delayed reflexes, weakened muscles, and diminished neurological function, hindering their ability to react effectively and increasing the severity of any fall. Finally, the bathroom itself contains numerous potential hazards. The hard surfaces of bathtubs, faucets, and sinks can inflict serious head injuries in the event of a fall. Loose items such as plastic chairs, buckets, or shower heads can also cause trips and falls. The cumulative effect of these factors creates a significantly hazardous environment for the elderly, necessitating proactive measures to mitigate these risks. Reducing the frequency of bathing significantly mitigates the risk of falls among elderly individuals through several key mechanisms. Firstly, infrequent bathing, 1 to 2 times per week, drastically reduces exposure to the inherently hazardous environment of the bathroom. This decreased frequency of bathroom visits directly correlates with a lower probability of experiencing a slip, trip, or fall-related accident. Secondly, bathing is a physically demanding activity, particularly for the elderly. Prolonged standing, bending, and reaching involved in showering can induce fatigue, dizziness, and loss of balance, increasing the likelihood of falls. Limiting bathing to 1 to 2 times per week, supplemented by the use of cleansing wipes or washing only the face and hands daily, conserves energy, prevents exhaustion, and consequently reduces the risk of falls. Thirdly, the abrupt temperature fluctuations between a warm shower and the surrounding environment can trigger transient hypotension, leading to dizziness and subsequent falls. Infrequent bathing minimizes exposure to these thermal shocks, thereby mitigating the risk of falls associated with sudden drops in blood pressure. Finally, less frequent bathing translates to reduced exposure to the inherently slippery surfaces of bathroom tiles and bathtubs. Furthermore, the decreased use of soap and shampoo contributes to a less slippery bathroom floor, further diminishing the risk of falls. In conclusion, a reduction in bathing frequency represents a demonstrably effective strategy for fall prevention in the elderly population. To mitigate the risk of falls during bathing, a multi-pronged approach is recommended. Reducing bathing frequency to 1 or 2 times per week, supplemented by daily cleansing of the face, hands, and perineal area with wet wipes, is a prudent strategy. The installation of non-slip mats throughout the bathroom is crucial to enhance traction and prevent slips. Furthermore, the strategic placement of grab bars within the bathing area provides essential support for elderly individuals entering and exiting the tub or shower, and when rising from a seated position. The use of a shower chair eliminates prolonged standing, a significant contributor to instability. A handheld shower head allows for thorough cleansing without excessive movement. Adequate lighting is paramount to prevent disorientation caused by poor visibility or steam-induced fogging of mirrors and glass surfaces. The consistent use of non-slip footwear within the bathroom ensures optimal grip on the floor surface. Leaving the bathroom door unlocked in case of emergency facilitates immediate assistance from caregivers. Finally, it is imperative to avoid bathing immediately after meals or when experiencing fatigue, as fluctuating blood pressure during these times increases the likelihood of dizziness and falls. These preventative measures, implemented comprehensively, significantly reduce the incidence of falls associated with bathing. 4. Conserve your body's energy resources. Bathing is a physically demanding activity. The process requires considerable muscular effort and coordination. While seemingly straightforward for younger individuals, each step presents a significant challenge for the elderly. Disrobing, entering the shower or tub, maintaining posture for an extended period, bending to wash feet, reaching to wash hair, and finally, drying and redressing. These actions can quickly induce muscle fatigue, particularly in the elderly who experience weakened musculoskeletal systems, arthritis, or balance issues. Hot water bathing further exacerbates this, causing vasodilation and subsequent hypotension, leading to dizziness, lightheadedness, and weakness. This is especially perilous for individuals with hypotension or cardiovascular disease. Finally, the post-bath process of drying and dressing demands considerable energy. Rapid heat loss following bathing necessitates increased bodily exertion to maintain warmth, further depleting energy reserves. The required dexterity and strength pose significant challenges for the elderly experiencing arthritis, tremors, or muscle weakness. Elderly individuals are demonstrably more susceptible to fatigue following bathing. This heightened vulnerability stems from 2 primary physiological factors: compromised cardiovascular and respiratory function, and the debilitating effects of prolonged bathing. Inefficient cardiovascular and respiratory function. The aging process inevitably leads to decreased efficiency in both the cardiovascular and respiratory systems. The heart and lungs, vital organs responsible for oxygen delivery and waste removal, exhibit reduced capacity, making the relatively simple act of bathing and the associated fluctuations in body temperature a significant physiological challenge. Individuals suffering from chronic obstructive pulmonary disease, COPD, or congestive heart failure experience exacerbated respiratory distress during bathing due to the reduction in inhaled oxygen caused by the humid, warm air. This compromised oxygenation further contributes to post-bathing fatigue, prolonged bathing, and subsequent debilitation. Extended periods spent showering or bathing, whether standing or sitting, induce significant muscular fatigue, compromised circulatory function, and dehydration. These effects are particularly pronounced in individuals already experiencing physical debilitation or managing chronic illnesses. The resultant fatigue can persist for several hours post-bathing, significantly impacting the individual's ability to engage in other daily activities and potentially reducing their overall quality of life. Therefore, careful consideration should be given to minimizing bathing duration and maximizing comfort to mitigate these negative consequences. Reducing bathing frequency conserves energy for essential activities. This energy conservation is crucial for maintaining the well-being of elderly individuals, allowing them to prioritize activities vital to their physical and mental health. Specifically, less frequent bathing frees up energy reserves for activities such as engaging in light physical activity, such as gentle walks, to maintain bone and joint health. Participating in social activities to improve mental well-being and combat social isolation. Undertaking light exercise or physical therapy to enhance strength and mobility. Allocating time for self-care, including relaxation, reading, and engaging with family and friends. Furthermore, reducing the frequency of bathing mitigates the risk of exhaustion and significantly improves quality of life. The physical and mental exertion associated with daily bathing can be considerable for the elderly, leading to fatigue and reduced energy levels for other important tasks. By reducing this burden, individuals can experience a decrease in stress and an increase in available time for rest and leisure activities. This in turn contributes to a more fulfilling and enjoyable life, free from the undue physical and emotional strain of daily bathing. Consequently, a strategic reduction in bathing frequency represents a proactive approach to energy management and overall well-being in the elderly population. Energy-efficient hygiene solutions include showering only 1 to 2 times per week instead of daily to reduce physical strain. Daily cleansing with wet wipes, focusing on underarms, groin, face, and extremities, is recommended. Utilize deodorant, dry shampoo, or light perfume to maintain freshness without frequent showering. Utilize a shower chair to minimize physical exertion and prevent falls. Employ a handheld shower head for easier cleaning without excessive movement. Ensure the bathroom is adequately warmed prior to showering to prevent thermal shock and energy loss from cold exposure. Regular changes of clothing maintain freshness and hygiene. 5. The body possesses an inherent self-cleaning mechanism. Human skin possesses a remarkable inherent self-cleaning mechanism. This process is primarily facilitated by sebaceous glands, which produce sebum, a natural oil crucial for maintaining skin health. Sebum performs several vital functions. It provides essential hydration, preventing dryness and flaking. It forms a protective barrier against harmful environmental factors and microbial invasion, and it contributes to skin elasticity, promoting suppleness and reducing the incidence of cracking. Excessive cleansing, particularly with harsh soaps or hot water, disrupts this delicate balance, stripping away the protective sebum layer and leaving the skin vulnerable to dryness, irritation, and increased susceptibility to damage. Furthermore, the skin's inherent ability to shed dead cells, a process known as desquamation, is integral to its self-renewal. This natural exfoliation removes old damaged cells, revealing a healthier, more resilient epidermis better equipped to defend against microbial penetration. Overwashing interferes with this crucial process, compromising the skin's natural defenses and rendering it more susceptible to inflammation and infection. Therefore, maintaining a balanced cleansing routine is paramount to preserving the skin's natural protective mechanism and promoting optimal health. The cutaneous microbiome plays a crucial role in maintaining skin health. Beneficial bacteria form a protective barrier against harmful pathogens. The skin is not merely a physical shield, it is a complex ecosystem teeming with a diverse array of microorganisms, collectively known as the skin microbiome. Commensal bacteria, such as Staphylococcus epidermidis, provide essential protective functions. They actively eliminate pathogenic bacteria through the production of natural antimicrobial enzymes. They maintain optimal skin pH, preventing irritation and inflammation, and they inhibit the colonization of harmful bacteria, such as Staphylococcus aureus, which can cause skin infections. Excessive cleansing with harsh antibacterial soaps disrupts this delicate balance, eliminating beneficial bacteria and compromising the skin's natural defenses, rendering it vulnerable to damage and infection. Furthermore, the skin's natural oils and sweat contribute significantly to microbial homeostasis. Sweat, in addition to its thermoregulatory function, helps maintain the skin's natural pH. The sebum layer provides a crucial habitat for beneficial bacteria, supporting the skin's innate immune system. Overwashing removes this essential sebum, disrupting the microbial balance, potentially leading to dermatitis, irritation, and increased susceptibility to infections. Therefore, maintaining a balanced skin microbiome is paramount for healthy skin and minimizing the risk of dermatological complications. The judicious use of cleansing agents is essential to avoid disrupting this crucial ecosystem. The human body possesses a self-regulating mechanism for odor control. Not all areas of the body produce unpleasant smells. Body odor primarily originates from specific regions containing apocrine sweat glands, such as the armpits, groin, and feet. Most of the body does not require daily showering for hygiene. Targeted cleansing of these areas is sufficient. Apocrine sweat glands, located in the armpits and groin, secrete sweat that, when decomposed by bacteria, produces odor. Eccrine sweat glands regulate body temperature and secrete odorless, dilute sweat. Excessive showering can paradoxically exacerbate body odor. Harsh soaps eliminate beneficial bacteria, allowing odor-causing bacteria to proliferate. Dry skin overstimulates sebaceous glands, potentially increasing rather than decreasing odor. Effective odor management without excessive showering involves daily cleansing of the armpits, groin, and feet with wipes or warm cloths. Utilizing antiperspirants or absorbent powders effectively controls odor. Daily changes of clothing, particularly underwear and socks, are crucial. The inherent benefits of allowing the body's natural cleansing processes to function optimally are multifaceted and demonstrably advantageous for overall skin health. Firstly, this approach preserves the skin's natural moisture barrier, mitigating dryness, itching, and cracking. Secondly, it fosters a balanced microbiome, crucial in preventing inflammation and irritation stemming from pathogenic microbial overgrowth. This equilibrium is further vital in maintaining the integrity of the skin's protective barrier, enhancing its resilience against environmental aggressors such as pollutants and UV radiation. Consequently, the risk of developing dermatological conditions, including dermatitis, eczema, and various infections, is significantly reduced. Finally, the body's natural self-regulation of odor is promoted, preventing imbalances in the skin's microbiota that can lead to unpleasant body odor. In essence, embracing the body's intrinsic cleansing mechanisms offers a holistic and effective strategy for achieving and maintaining healthy, vibrant skin. Maintain hygiene without excessive showering by limiting bathing to 1 or 2 times per week, unless strenuous activity necessitates more frequent cleansing. Daily cleansing with a damp cloth should focus on the underarms, groin, and feet. Wear clean, breathable clothing to wick away moisture and minimize odor. Employ antiperspirant or talcum powder to control odor without compromising skin hydration. Frequent hand washing and facial cleansing are crucial for maintaining hygiene while preserving the skin's natural cleansing mechanisms. 6. Alternative measures. Employing warm or moistened cloths for body cleansing offers a compelling alternative to traditional bathing, providing several key advantages. This method effectively maintains hygiene without the extensive water exposure associated with showering or bathing. The process efficiently removes perspiration, dirt, and bacteria from critical areas such as the armpits, groin, and feet, thereby minimizing the risk of odor and infection. Furthermore, this approach mitigates the potential for skin dryness, as it avoids the stripping of natural oils that often occurs with hot water and soap. For optimal efficacy, utilize alcohol-free and chemical-free wipes, paying particular attention to areas prone to bacterial accumulation and perspiration. The armpits, with their high concentration of sweat glands, require diligent cleansing to prevent odor development. Similarly, the groin area, susceptible to bacterial overgrowth and subsequent infection, necessitates meticulous hygiene. Finally, the feet, often harboring significant bacterial populations and prone to perspiration, demand thorough cleansing to eliminate unpleasant odors. Alternatively, a warm, damp cloth can be used to cleanse the entire body when a full bath or shower is deemed unnecessary. Following the cleansing process, the application of a light, moisturizing lotion is strongly recommended to prevent cutaneous dryness and maintain optimal skin health. This method provides a practical and effective hygiene solution, particularly beneficial for individuals with limited mobility or those seeking to conserve water resources. Daily changes of clothing are essential for maintaining personal hygiene. The significance of clean clothing in hygiene is paramount. Soiled garments harbor bacteria, sweat, and dirt, significantly increasing the risk of skin infections and related complications. Wearing clean clothing promotes a feeling of freshness and cleanliness, even in the absence of daily bathing. Furthermore, the absorbency of clean clothing contributes to odor reduction and the maintenance of a dry, comfortable environment against the skin. Implementing effective clothing hygiene practices requires diligent attention to detail. This includes the mandatory daily change of underwear to safeguard intimate hygiene and prevent the proliferation of microorganisms in sensitive areas. The selection of clothing fabricated from breathable materials, such as cotton, is crucial for optimal sweat absorption and the prevention of excessive moisture accumulation. Socks should be changed frequently, particularly for individuals prone to excessive foot perspiration, to mitigate the risk of fungal infections and unpleasant odors. Finally, proper garment care involves drying clothing in a well-ventilated, clean environment to inhibit bacterial growth and maintain the longevity and hygiene of the garments. Neglecting these practices can lead to a range of health issues, underscoring the importance of consistent adherence to these guidelines. Employ antiperspirant or absorbent powder. Antiperspirants effectively manage body odor. While sweat itself is odorless, bacterial decomposition produces unpleasant smells. Antiperspirants or deodorants control odor-causing bacteria, reducing the need for frequent bathing. Absorbent powders maintain dry skin. The elderly are prone to moisture accumulation in the armpits, groin, or under the breasts, fostering bacterial and fungal growth. Absorbent powders, such as talcum powder or cornstarch-based powders, keep these areas dry, minimizing the risk of rashes and fungal infections. Application instructions. Apply antiperspirant after cleansing the armpits to control perspiration. Apply absorbent powder to sweat-prone areas such as the armpits, groin, and feet. Avoid overuse of products containing harsh chemicals, which may cause skin irritation. Overwashing hair can lead to dryness and scalp irritation. The scalp naturally produces oils to moisturize and protect the hair. Frequent shampooing strips away these essential oils, resulting in dryness, itchiness, and potential scalp imbalances. Therefore, minimizing shampoo frequency is crucial for maintaining healthy hair and scalp. Alternative solutions exist to manage oiliness and maintain cleanliness without the detrimental effects of daily or even frequent washing. Dry shampoo offers an effective solution by absorbing excess oil at the scalp without the need for water. This method allows for the refreshing of hair between traditional washes, maintaining a clean and presentable appearance. For minimally soiled hair, gently wiping the scalp with a damp cloth can effectively remove surface dirt and oil, providing a refreshing sensation without the harshness of shampoo. This technique is particularly beneficial for individuals with sensitive scalps prone to irritation. Furthermore, regular brushing distributes the scalp's natural oils along the hair shaft, resulting in a naturally conditioned and lustrous appearance. This simple act helps to maintain a healthy sheen and reduces the need for frequent washing. By incorporating these strategies, individuals can effectively manage hair oiliness, promote scalp health, and minimize the negative consequences associated with excessive shampooing. The adoption of these alternative methods ensures the maintenance of clean, healthy, and vibrant hair. Regular hand and face hygiene is crucial for maintaining health and well-being. Hand washing is essential due to the high concentration of bacteria on the hands, which can easily transmit disease if not regularly sanitized. Facial cleansing is equally important as the skin's natural oils and accumulated dirt can lead to acne and irritation. Effective hygiene practices include washing hands with soap at least 2 to 3 times daily, especially after using the restroom and before eating. Facial cleansing should be performed twice daily, using lukewarm water and a mild cleanser as needed. Gently pat the skin dry with a soft towel, avoiding harsh rubbing to prevent irritation. Maintaining a clean living environment is crucial for personal hygiene. A clean bedroom and bed contribute significantly to a feeling of cleanliness. Bed linens and pillowcases accumulate sweat, oils, and dust. Infrequent washing can lead to skin irritation. A clean living space promotes a feeling of freshness, minimizing bacteria and odors. Implementation: change bed linens at least once a week to prevent bacterial buildup. Ensure adequate ventilation in the bedroom to prevent dampness and musty odors. Utilize air purifiers or mild air fresheners to maintain a pleasant scent. 7. Expert advice. Scientific basis for the recommendation to reduce bathing frequency in the elderly. Age-related skin changes. Research from the University of California, San Francisco, and the University of Pittsburgh demonstrates that the epidermis, outermost skin layer, thins with age, reducing its capacity for water retention. Sebaceous glands become less active, leading to increased dryness and skin irritation. Reduced collagen and elastin result in decreased skin elasticity, increasing susceptibility to tears and bruising. Frequent bathing removes the protective lipid layer, increasing the risk of dermatitis, itching, and infection. Bathing and fall risk. The CDC reports that over 1/4 of individuals over 65 experience falls annually, with bathrooms being the most hazardous location. Reducing bathing frequency decreases exposure to slippery surfaces, mitigating the risk of serious falls. Efficacy of alternative bathing practices. Research published in the Journal of the American Geriatric Society, JACS, indicates that older adults bathing once or twice weekly while maintaining daily hygiene of essential areas exhibit lower rates of dermatitis and skin irritation compared to those bathing daily. Cleansing with wet wipes and changing into clean clothing maintains a feeling of cleanliness without compromising the skin's natural moisture barrier. Regarding bathing frequency for the elderly, medical organizations offer the following guidance. The American Geriatric Society (AGS) recommends bathing only 1 to 2 times per week for individuals over 70, contingent upon health status and activity levels. Daily bathing is discouraged as it can strip natural oils and lead to dry skin. The American Academy of Dermatology (AAD) advises using lukewarm water instead of hot water to prevent moisture loss. Mild, fragrance-free soaps without harsh chemicals should be used. Immediate application of moisturizer after bathing is crucial to prevent dryness and cracking. The Centers for Disease Control and Prevention (CDC) notes that less frequent bathing can reduce the risk of falls by minimizing exposure to slippery bathroom surfaces. The use of shower chairs, grab bars, and non-slip mats is strongly recommended to mitigate injury risk. Johns Hopkins University emphasizes that less active individuals, or those who do not perspire heavily, do not require daily bathing. Daily cleansing of the underarms, groin, and feet with a damp cloth or soft sponge is sufficient. Regular changes of clothing are more critical than daily bathing. Expert advice on showering frequency and safety. A. Showering frequency. Based on health status, sedentary individuals, primarily indoors, minimal sweating, showering once weekly is sufficient, supplemented by daily hygiene of specific areas. Individuals with light physical activity, walking, gardening, showering twice weekly is recommended to cleanse sweat. Individuals with specific conditions, dermatitis, sensitive skin, chronic illnesses, shower less frequently but moisturize more often. Avoid harsh soaps. B. Safe showering practices for seniors. Shower during daylight hours when alert and well lit to prevent falls. Utilize shower chairs or grab bars for support entering and exiting the shower. Avoid excessively hot water. Use lukewarm water to prevent skin dryness. Limit showers to under 10 minutes to avoid hypothermia and exhaustion. Apply moisturizer immediately after showering to maintain skin hydration. Discover the secret to bathing after 70. Reducing bathing frequency doesn't equate to poor hygiene. Rather, it's a crucial method for protecting skin, preserving health, and minimizing fall risks. Simple alternatives such as washing with moist cloths, changing into clean clothes, and using deodorant effectively maintain hygiene without daily showering. Share your thoughts. Were you surprised by this information? How have you or your loved ones adjusted bathing habits? Comment below and share your experiences. Like this video if you found it helpful, and subscribe for more vital information on senior health. Join us in future videos as we explore the secrets to a healthier, longer, and happier life.